Okay, welcome everyone. We are so excited to have everybody joining us today for this wonderful event. We've been planning it for quite some time now and have a tremendous outpouring of interest. And so we are actively thinking of ways that we keep this discussion going on this topic and hope that this event also proves that we should keep that going. So welcome everyone. To Recovery After Incarceration, the Role of Peers in the Reentry Process, a webcast designed to identify the factors contributing to justice system involvement among individuals who live with mental health conditions, and to introduce Reentry Peer Specialists, an emerging role in the mental health workforce for supporting individuals living with mental health conditions as they reintegrate into their communities after incarceration. Today's webcast is brought to you by the South-Southwest Mental Health Technology Transfer Center, an initiative funded by the Substance Abuse and Mental Health Services Administration to provide free training and ongoing consultation to the diverse array of professionals that serve individuals with mental health challenges across our 5-state region, which you'll see highlighted on this map of our country. Our region is the purple region on this map, which includes Texas, Oklahoma, New Mexico, Arkansas, Louisiana, and several tribal communities. My name is Alicia Welch. I'm the program administrator for the South-Southwest Mental Health Technology Transfer Center. I'm going to use MHTTC for short. As you can imagine, it's a mouthful. If you have questions about that, please let us know. But every region across the country has its own regional MHTTC. There are also national TTCs, one focused on Hispanic Latino communities and one focused on American Indian and Alaska Native communities. You can visit SAMHSA's website or our website to learn more about the TTC network. The South-Southwest Mental Health Technology Transfer Center is a project of the Texas Institute for Excellence in Mental Health, which is housed at the Steve Hicks School of Social Work at the University of Texas at Austin. This is our wonderful team who have all contributed to making this event possible, and we work closely together to deliver the best training and technical assistance services that we can across our region. Today's event coincides with our rollout of a framework we developed to help conceptualize our training and technical assistance for providers, agency officials, and other stakeholders that interact with individuals who have one or more mental health conditions and who are involved in the justice system, which you can see on this criminal justice continuum image. The continuum shows how individuals move through the system from arrest to release and reentry, and each color-coded node represents a point on the continuum that offers an opportunity for training and technical assistance on best practices. Some of you may be familiar with the sequential intercept model or the sequential intercept mapping process that shows the various intercepts along the criminal justice continuum in which an individual involved with the justice system might be diverted or released. Our framework builds on SIMS to highlight the points within the justice system in which evidence-based and best practices can be implemented to advance better health and safety outcomes. This could include, for example, diverting people with mental illness who commit low-level offenses away from correctional facilities and into treatment settings. That would be on what's referred to as the front end of the criminal justice system, or these yellow or orange nodes. It could also include expanding training for jailers and correctional staff on mental health issues and de-escalation techniques. That would largely focus on the jail and prison node that you see highlighted in red. As would improving mental health screening, safety, and suicide prevention procedures in correctional settings. That would also be highlighted in that red node. Our event today is focused on promising practice in reentry, our purple node here. This framework will also be an interactive tool on our website so that you can click on each of these nodes to get a more detailed understanding of that point on the justice system continuum and the intersection with mental health. For example, if you were to click on the reentry circle for today's event, you'd be directed to the next slide, which would have the details about the particular practice that we'll be highlighting today, developed by our very own Sandra Smith, who I'm about to introduce. But this release and reentry screen gives you a good sort of overview of what that node is, what promising practice will be featuring, and some of the details about the event that we'll be covering. So keep an eye on this interactive tool that we'll have fully rolled out on our website very soon. and you can explore potential trainings and opportunities for technical assistance that might benefit you and in your current capacity or might spark an idea for you. Please feel free to reach out to me anytime to discuss your training and technical assistance needs. I've sent a couple of emails from my email address. I'll share my email address again at the end of this training, and then you will likely hear from me for future emails and correspondence regarding some of the follow-up requirements that we have for this event. But before we dive into our agenda and introducing our speakers, I have a few housekeeping things to go over with you. The first is that to request that you complete a post-event evaluation of today's webcast. In order for us to continue to provide free events like this one, SAMHSA requires us to collect anonymous evaluations from participants and report the results. At the end of our webcast today, I'll display a link to the evaluations that you can use to complete the evaluation immediately. The evaluation link is a little bit complicated with a lot of numbers and symbols and signs, so we'll also, my colleagues that are sitting with me here providing some of the technical support in the background, will share that link in the chat box, and we just ask you to click on that link, copy and paste it, and you can immediately access it and fill it out. It's very short, pretty simple, hopefully easy for you all to fill out, but of course let us know if you have any questions about that. And that really, the results and showing how many people completed that survey is what SAMHSA uses as an indicator for how many people attended the event. That's why it's so important, so that SAMHSA can see just how important these topics are for you. Next thing, for those of you who are in need of CEUs, we are able to offer CEUs today, so excited about that. The evaluation form also functions as our post-test for today's event, which is required in order for you to obtain your CEUs. So please plan to complete that evaluation immediately after the event. And then also, second step is to email me and let me know what CEUs you need, and I'll also obviously need to know your name. And at that point, I can send you a certificate once I verified your attendance. I will note that if you do need to leave early, we're not able to offer partial CEUs for the time you spent in the webcast. However, I'm very excited to report to you that today's webcast will be recorded and archived so that you can return to complete the portion of the webcast that you missed today. Or if you have other colleagues that would be interested in attending today's event but couldn't because they had another event or scheduling conflict, I'll be sending out the link to the archived video when it's ready for you, and you can distribute that accordingly. And it'll be linked to the platform that you use to get CEUs, and we'll send some instructions around getting those CEUs for you. So just please know that the opportunity still exists. On that note, as we're talking about colleagues and coworkers, I recognize that some of you may be viewing today's events on a coworker's computer. While we welcome as many participants as possible, and it's certainly perfectly fine for us for you to be joining in that way, we do ask that everyone that's viewing today's event register for it. So if you're on and connected and hearing about it, but you have not registered for it, please, please, please register for it. Again, it's numbers that get back to SAMHSA so that SAMHSA can see just how high demand this topic is in this event and activity. And those numbers are the numbers that we track to sort of report that to them. Now I'm going to focus attention on the slide that I pulled up on the agenda. Again, I said this at the beginning, but for those of you that have just joined us since I started, we are so thrilled to see the interest that the webcast has generated. Towards the end of the event today, Sandra Smith is going to discuss what comes after this webcast for those of you that are interested in becoming Reentry Peer Specialists or know someone who might be interested. Today's webcast is to highlight the factors that impede individuals' ability who have justice system involvement from accessing mental health interventions that they need to live in recovery. And then provide a sort of introduction to reentry peer support as a very promising practice for you all to consider weighing on whether you get certified to be a reentry peer specialist, whether you know someone who ought to be certified as a reentry peer specialist, or if you are an employer or know of an employer who ought to hire reentry peer specialists. We really would like you to share the content of this webinar with them. Encourage them to contact Sandra for more information about that. So today's agenda, I'm going to review I'm going to introduce our wonderful presenters. We're going to go over some of the background and context for the criminal justice system, interaction with mental health system, and what that means for reentry. We're going to talk a bit about why does this topic matter? Why are we even talking about it today? And then we'll conclude by talking about reentry peer support, specifically in the context of what can we do about all of these things and in the intersections of all of these issues and the outcomes it's leading to. So after I lay out a bit of the context, I'm going to turn it over to our presenters, and we'll proceed with a question and answer format between me, Sandra, Joe, and Red. In part, that is to encourage this to be a conversation and a dialogue. But it's also to model the peer relationship, which is about sharing and lived experiences. And that's really important for the peer model. Many of you who are on might already know about that as it relates to their mental health peer supports or recovery coaches. But we really wanted to model that structure. Because we're not following a traditional format for this event, though, I'd like to flag your attention to the comment box on your Zoom platform. Please feel free to ask questions through the chat box. While we want this to be interactive in a question and answer format, about over 300 people registered for this event. So if everybody tried to dive in with a question at the same time, it would just get very chaotic and confusing. So I've got a remarkable team of colleagues that are supporting me through this and will be actively monitoring that chat box. So please do just type your question into that box and I can relay those questions to the presenters. The last thing before we get started is I just want, in order to limit the background noise while our presenters are speaking and while I'm asking them questions, we've automatically muted all of you on your Zoom connections and asked just that you don't unmute that. Sometimes it happens accidentally, and again, my esteemed colleagues will be watching for that and will likely mute you before you've even noticed. But just so you know, if you happen to hit that button and then you're automatically muted, it's us in the background. So let me get started by introducing our incredible presenters and experts on today's webcast. They really are phenomenal people and professionals and have a wealth of expertise to share with you all today. I will start with proudly introducing Sandra Smith. She is the Peer Programs Manager at Via Hope in Austin, Texas. Via Hope's our mental health resource in Texas. They really play a very prominent role in the peer world here in Texas, which has in the last, I would wager a bet to say between the last 7 to 10 years, Texas has really made great strides in focusing its efforts on building out peer specialists across its behavioral health workforce, both on mental health and substance use side. And Via Hope has really been the center of that and very integral to that, rolling that out. So I am so honored to have Sandra here and joining us. She was really the impetus for this event. She has led the development of the Reentry Peer Specialist role here in Texas. She spearheaded the design of the training modules and curriculum, and she was instrumental in establishing Reentry Peer Specialists as a certified professional. Dr. Smith previously served as the Associate Director of a Recovery Community Center in Dallas and has served as a University Professor, Campus Dean, and Regional Dean. She's a licensed chemical dependency counseling intern, a certified peer recovery support specialist, and a SAMHSA Gains Center trainer for how being trauma-informed improves the criminal justice system responses. Dr. Smith holds a Master of Science in Administration from Central Michigan University and a Ph.D. in Human Services from Capella University. She's a published author of Choices, which chronicles her life story, and her dissertation on support services was chosen for republication by Scholars Press, an international dissertation clearinghouse. She's a reentry advocate based on her own lived experience with incarceration. And her and I have been working closely on this and have really developed a wonderful working relationship. So thank you, Sandra, for all that you've done to advance this role in the field and really be working in such a collegial manner to get this all rolled out. I'd also like to introduce Dorson Red Gilbert. He goes by Red. He is the mental health peer specialist and reentry peer specialist at Texas Rio Grande Legal Aide, or TRALA for short, as we Texans like to say. where he works with individuals with serious mental health challenges who are incarcerated and receiving legal representation for trauma. He really prides himself on advocating for his clients' self-determination. Red has also worked in the jail diversion program at the Center for Healthcare Services. His lived experience with long-term incarceration made Red an active advocate for supporting others returning to freedom from incarceration. He's a member of the Via Hope Reentry Peer Specialists beta testing group, which Sandra and Red will both say a bit more about in today's event. And Red completed the first ever Reentry Peer Support Specialist training in Texas. And he's also already a certified mental health peer specialist. Just a wealth of knowledge. Also on today's call, we have Joe Powell. Joe is the president and CEO of APA, the Association of Persons Affected by Addiction, which is located here in Dallas, Texas. It's a recovery community organization for people seeking or actively in recovery and peers with co-occurring mental health challenges. Joe Powell is in long-term recovery himself with 31 years free of alcohol and other drugs, and has been a licensed chemical dependency counselor for 25 years. He comes from a family, 7 or 8 siblings, who all have experience in recovery, and really draws on both his personal experience and professional to really inform the expertise in this field. APA was established through funding from SAMHSA in 1998. It was the first peer-to-peer recovery community organization in Texas, the first in Texas to receive national accreditation, the first 5 in the nation. It was also the first peer recovery community organization in the nation to build a managed care organization, which is had phenomenal transcending impact here in Texas, as well as across the country. Mr. Powell is the current chair of the peer committee for the Texas Certification Board and is a trainer of trainers for Certified Recovery Support Peer Specialist, Texas Overdose Naloxone Initiative, MAT, the Medication Assisted Treatment, and MARS, Medication Assisted Recovery Support Services. He started the first African American NAMI, National Association for Mental Illness, in South Dallas in Texas. He did that in 2000. He served for 10 years as one of the founding members of the National Faces and Voices and was the president of the National Leadership Council on African American Behavioral Health. He chaired the largest Big Texas Rally for Recovery in 2016 and 2019, just this year. Joe's a servant leader, innovator, and initiator of peer recovery support services and a national subject matter expert in the peer recovery movement. We're so incredibly honored to have him as part of this event, as well as all of our presenters. I'm going to, as I said, just provide some of the background and context. I'm a policy wonk, really operate at the systems level, but have been in criminal justice reform for the last 15 years, really centered on the intersection of criminal justice and behavioral health. So you might be thinking, well, you've got all of these experts, they could do these things. Well, the presenter experts asked that I do this. I really want to then turn it and have them inform what I've said and correct me and move, as I had said, forward in a dialogue manner. So here we go. As we all know, individuals that are living with a mental health condition are disproportionately impacted by the criminal justice system here in the United States and especially in Texas. Over half of all adults who are incarcerated in the US prison system and jails have at least one mental health condition. Texas has the 7th highest imprisonment rate in the US, with African Americans in Texas being 4 times more likely than whites to be incarcerated. And those racially disproportionate figures also intersect with the mental health system. I'd also like to note on these slides, the number references refer to citations, which will be available later and after our webcast today. So what's driving this disproportionality, right? Why are individuals with lived experience with a mental health condition so disproportionately involved in the criminal justice system? Well, individuals with mental health conditions who are involved with the justice system are also more likely to have experience with drug use. They have experience with homelessness or housing insecurity. They've survived abuse or other trauma experiences. Sometimes those are adverse childhood experiences. Sometimes those are other trauma experiences in their adulthood. They've also experienced physical and behavioral health conditions. Sometimes those are co-occurring with their mental health conditions. They experience those at higher rates than the general population. They also have experienced a lack of access to supports and services in the community to a greater degree than the general population has. They've also experienced more inconsistencies around employment histories. If there are unmet mental health conditions, you can imagine that that impacts stability around employment and long-term sustainable employment. They also, to a greater degree, lack of educational achievement score and vocational training skills that are required by our workforce. And that last point really informs the ways in which reentry peer support specialists fill critical need, both in terms of supporting individuals as they exit, but then also giving them a source of income to really generate that stability and fill those inconsistencies in their employment histories, which I know our presenters will touch on. So if those are all of the things that are driving in the factors that are sort of resulting in individuals with lived experience and with mental health conditions to be involved in the criminal justice system, what happens once they're inside? What are conditions like in facilities? Well, what we know from research is that incarceration can exacerbate any underlying mental health conditions. So that's true of trauma experiences. Individuals with lived experience with mental health conditions are at a greater likelihood of experiencing trauma when they were inside incarceration settings, both in prisons and in jails. They're more likely to experience physical abuse, more likely to be punished for some of their behaviors that may stem from their mental health conditions. And punishment or a sort of behavioral response inside of prisons and jails usually results in some form of administrative segregation, solitary confinement. So individuals being isolated for upwards of 23 hours a day with only 1 hour of time to leave their cell. When they do leave their cell, they are provided recreation time, but recreation time is also pretty restricted. They're also at a greater likelihood of experiencing physical and sexual abuse inside of facilities. And again, these are things that can happen. They don't always happen, but these experiences really do exacerbate these conditions. What also exacerbates conditions are interactions with staff. So much of the prison and jail experience is based on this punitive approach that we take to individuals who are incarcerated. And that punitive approach can and often does happen through interactions between staff and individuals who are inside. Staff, of course, believe that that is necessary as a result of safety, but there are ways that we can talk through healthier interactions that staff can both ensure the safety of individuals that are inside, ensure staff safety, because that is also a concern, and ensure that people are reaching and achieving healthy outcomes for both behavioral health and physical health. The physical environment also can exacerbate any underlying mental health. So there's a really robust area of research on what's called biophilic design, and that's around the physical environment and the ways in which that impacts individuals' mental health. So we see this a lot in emerging hospital design. We see a lot of hospitals, physical health hospitals, that draw in things like big windows to get in natural light and are built near trees and other landscapes to have access to natural surroundings, because what research has shown is that literally our brain chemistry changes when we are exposed to the natural elements, and that can lead to more positive mental health outcomes. We also know that incarceration can exacerbate underlying mental health conditions through strained family relationships. Individuals that become involved in the criminal justice system, so many are at a greater risk of already walking into the incarceration experience with strained family relationships. And because of the location of facilities, because of the procedures that are involved with family visitation in those facilities, that can lead to continued strained family relationships. There's not as much opportunity for contact. Where there is contact, there's often a lot of restriction for children entering a prison or jail space. That can be somewhat of a traumatic experience for children who have to go through things like walking through metal detectors and watching parents be searched. And those things can really add to an exacerbation of these mental health conditions. So that's what's going on inside. There's also a lack of robust supports and services that are aligned with research modalities. And what research is telling us is that for anyone with a mental health condition, best practice scenario, broadly speaking, is to provide folks supports and services in the community as best we can in the most least restrictive settings. Prison or jail is not defined by least restriction, right? It's defined by restriction and often pulling in that safety component. Again, there are ways that we can think through and talk through how we get supports and services that can model a community-based approach and have community providers come into the facilities, begin the relationship while folks are inside, and continue that relationship as individuals are released. And it is an element of Reentry Peer Support Services, and I'm so glad that we'll be able to talk about that related to this practice. But I want to flag that for you all. What are the barriers that folks face as they're reentering? This is true for individuals with or without behavioral health challenges. These needs get exacerbated when we're talking about individuals specifically with lived experience. They're facing barriers to housing, so that results in oftentimes housing insecurity or homelessness. If you all have the experience of going to rent an apartment or a home, you know that there is often a checkbox on a housing application that asks if you have ever been convicted of a crime or a felony. Applications that often indicate that are placed at less priority for landlords. There are policies that shape that, policies that add liability to landlords. Who do, for the landlords who do accept individuals with criminal background, there are additional liabilities they have to take on from an insurance standpoint. There are a lot of factors weighing into this. Access to treatment and services are more difficult for individuals with mental health conditions. They may not have had access to those supports while they were inside, and so that trusting relationship isn't built to begin with, which makes it harder when they're so overwhelmed by the experience of being released from the institution to know, who do I go to? What do I access? I don't even know fully what my needs are, and so how would I know what service really to seek out? Sometimes because the criminal justice system has shaped our culture in so many ways, even supports and services sometimes have a punitive approach in their understanding of how we take care of folks who have justice system involvement. I would say that in recent years, we're moving out of that mode, and so many supports and services are becoming well aware of the ways in which stigma applies to folks who have mental health experience and also folks who have justice system experience, but that is an underlying piece of our culture that we need to be aware of. There are also limited employment options, as I mentioned with housing applications. Same thing exists with employment applications. You are probably well aware of ban the box movements. So we know that there are boxes on employment applications that ask if somebody has criminal justice system involvement. And when an employer is comparing two applications, one with that box checked and one without, if all else is equal with one another in terms of skills and experience, historically, traditionally, that employer is often not likely to choose the individual with a criminal background. Again, employers also face additional liabilities put in place from different policies that create additional liabilities, and from insurance perspective can, if anything were to happen, put that employer out of business. So this is multifaceted, comes at it from many different angles. We all need to be aware of all of that. I touched on some of the stigma that individuals face when they are released from a justice system setting. Know that if you are aware of the stigma that individuals living with experiences with mental health conditions face, it is only exacerbated by the additional stigma that is on individuals who have any history of justice system involvement. So why does this matter, right? We have a lot of people locked up in this country. I think most folks are well aware of the statistics in this country. We have 2.3 million people locked up in prison and jail, even more individuals involved in our community probation and parole, essentially, community supervision models, which really move that number up to closer to 5 to 7 million individuals. So we're talking about a lot of folks. This particular graphic is from the Prison Policy Initiative that shows some of the details of the number of people that are involved in each piece of our justice system now. But we are talking about a lot of individuals. And as I shared, individuals with lived experience and living with a mental health condition are disproportionately impacted. So you can imagine the numbers that we're talking about here. We also know that to a large degree, our justice system isn't preventing folks from coming back to the justice system. So the Bureau of Justice Statistics does regular updates on recidivism statistics. We know that of all of the people that are locked up, we know that approximately 95% of those individuals are released at some point. Within 3 years of their release, about 2/3, almost 68% of those who are released are rearrested. Within 5 years of release, that moves up to 76%. Different age groups experience that differently. When we're talking about the young adult population, you see upwards of 80 to 90% recidivism rates. So we know that something's not working right with our criminal justice system. I think that's talked about to a great degree right now. You can think that that's even more so true for individuals who are living with mental health conditions. Presenters will dive into. Our last form I'll get to with evaluation. But now I want to turn it over to our presenters. You've heard me go over from a high level systems policy wonky perspective, what's shaping the experience for individuals who are involved in the justice system, who are living with mental health conditions. Could each of you talk about those things from your own experience? And maybe Sandra, if you can kind of kick it off, speaking to your experience and also talking about some of the nuances that really stuck with you as you began thinking about ways in which you wanted to bring change to the system.
Sure. Hi, Alicia. First, I'd like to thank you for just making this possible, and all of the folk over at the Southwest MHTG and HTGC. And I know the acronyms are crazy. And just allowing us to take some time out and discuss something that is obviously a passion for me, but is also at a national crisis state right now in this country. For me, my experience navigating the reentry process, I consider myself a unicorn, particularly because my experience in reentering was not that of the majority of people that are incarcerated. And that actually, interestingly enough, led to me having this passion for trying to do whatever I could do to support those individuals that were not as lucky as myself. And by lucky, I mean, I had a job when I got out, and I had a place to live when I got out, and I didn't have the struggles of trying to get my ID. I didn't have to deal with a lot of the barriers that you had listed earlier on the slide. And what made me come out with this passion was interacting with those individuals that were incarcerated with me, and just coming to the realization that they were people. They were people that had a need to take care of families, to take care of their children, to support, to have employment, to do a lot of things, but I ended up in a substance use unit, for lack of a better word. And I personally didn't have an experience with addiction, but I was coaxed into saying that I had so that I could get out earlier. And just the fact that that is a thing within a system. Mind you, I was incarcerated in New York, and I spent 6 months at the world's boldest, Rikers Island. And then I basically went to every female facility in the state of New York. And having had that experience just opened my eyes so much to how broken our system is. And again, it helped create this passion for me. And I literally made a promise when I left that I would do everything. I would take advantage of every platform that I could find to try to better this system. So my experience was quite different. I just happen to know Red's story, but just having the opportunity to create this training and certification that we're going to talk about a little bit later, and having people like a Mr. Joe Powell that actually served as my mentor and taught me pretty much everything I know about peer support. There's a huge amount of support out there, and it's not for everybody. It's not something that any and everybody is going to even believe is necessary. And I ran into a lot of that in trying to develop and create the certification. But what I would like to just say is that for those that have taken the training, we're literally in the 5th day of our 3rd training right now. And the training participants are downstairs, hopefully logged in and listening. But the experience that they're having is proof to me that we're on to something good that's going to help a lot of people.
Absolutely. Thank you, Sandra. Red, could you also, could you jump in and first introduce yourself, correct anything I may have misstated, and talk a bit about your experience as well, navigating the reentry process, what the experience was like for you after you got out, how easy or difficult was it to access supports and services, and what changed for you once you identified and really saw the need for providing or becoming certified first as a mental health peer specialist and then as the reentry peer specialist?
Sure. I was released in 2009 from TDCJ. I had served an 8-year sentence. When I got out, there was nowhere for me to go. I was homeless for the first 6 months I was out, lived in a homeless shelter. My parole officer visited me in a homeless shelter. I was depressed. I was having all kinds of struggles. Couldn't find a job, couldn't find a place to live. I finally found out that Goodwill would hire convicted felons. I went there and I got the job and started saving every dime until I got a place to live and moved into it and just kind of kept working going forward. And I can tell you that there was very little as far as resources for people coming out of prison. There wasn't anything given to me before I left prison to give me direction or to give me advice on how to go when I got out. There was nothing there. It was like, you got a bus ticket, you got a onion bag with your clothes or whatever you had, you got one set of clothing from the TDCJ, a check for $50, and then you got a bus ticket to a bus station and a bus station ticket to the county that you fell out of or where you were incarcerated from. So there was nothing really in place. You get off a bus in a town at 9 o'clock at night, and you don't have anybody waiting for you. You have nothing. You're just standing there, and everybody knows from having been at the bus station why you're there. They can tell by the onion bag, hey, this guy just got out. So you're like marked. It just takes a long time to get on your feet if you don't have someone waiting for you when you get out. The other part of that problem is that because I work with people all the time, a lot of people, the only person that they have to meet them when they get there or to call when they arrive is the people they were doing dirty with before they went to prison. So they call them up, they say, hey, I just got out, can you help me? Yeah, sure. And so that's why the recidivism rate is high. Or they have a family that's criminally involved, and the next thing you know, they're going back to that family and getting right back into the game, and they fall back into that trap. So that's how my release went for me. I'm blessed now because I worked myself up out of it, but I have the tools now.
Thank you for sharing. That's so many points within there that I'm excited to dive into. Joe, could you also introduce yourself, again, correct anything that I may have misstated in your bio, and then also talk a bit about your experience as mental health peer support, sort of what that's been like for you and what it's been like for you to develop this level of expertise and sort of how you've seen, I think that you've got the longest sort of trajectory in this field and in this role in particular, and have really shaped the field. And so what have you seen over time? And now as reentry peers supports are becoming, real an emerging role, what has that been like to see the field even develop into additional certifications? Could you talk a bit about your experience as well?
Yeah, first of all, I just need to say thank you, Alicia, and the mental health TTC and Sandra and Red for being here with me. I need all the support that I can get anytime I do presentations. But I am Joe Powell, and I am a young person in long-term recovery. And of course, only because of long-term recovery that I'm able to be a father and a husband today, and a lifelong learner today, and a servant leader today. And the CEO of APA, the Association of Persons Affected by Addiction here in Dallas now for 21 years. And, a recovery community organization. I think that SAMHSA, again, with the work that we're doing and what we're talking about as far as the justice involved, SAMHSA, of course, always took the lead on, so how can we support and be of service and really to move folks to recovery. And I always say health, wellness, and recovery, because it's all about being healthy for me. With SAMHSA, I do want to say this too, before I get into also myself, is that SAMHSA also, at the time when we did the definition of recovery, which is a process of change to improve our health and wellness, live a self-directed life, and strive to reach our full potential. We also had Betty Ford Institute was doing a definition at the same time. And in that definition, they included citizenship. And that was mainly about, that, we have a lot of folks, that's, especially people with addiction and mental health that have the justice involvement. And now, after spending so many years, whether in the streets or in prison now, how do I become a citizen? And what does that look like for me? I don't know what that's like. Now, of course, for me, I only had one DWI, and I went to jail that one time for that DWI that I had. And I didn't have any peer support when I came out, or nobody. That was a long time ago. But it was an honor though for me to really take the lead with the Association of Persons Affected by Addiction, White Faces and Voices of Recovery, all of the folks that are the pioneers that really started a lot of this recovery movement that we have today. And so you said a lot in the first half an hour, and I just wanted to.
I did.
Yeah. But but it was so much that you tied into as far as that. What is APA as far as a recovery community organization? The opportunity that we have had these last 21 years to build relationships and to prevent more recidivism, to prevent folks from going back to jails and prisons and institutions, but also working with. Our goal is all about recovery. Our mission is to educate all segments of the community about addiction and mental health and provide recovery support services. So that means a lot of community building and a lot of relationship building that we have had to get to where we are today. So I'm excited that one is that, you know, the courts, all of the specialty courts now that we didn't have when we first started, there wasn't divert court and reentry courts. Now we have reentry courts, we have divert courts, we've got drug courts. We're in veterans courts, we're in the community court. There's even a community court. You know, we've had all these courts where we work with the judges, and judges that really wanted peer services. They knew about recovery, have been educated on recovery, and was willing to really to say, hey, why don't we get some peer support and some peer specialists here in the courtroom? And that's another, of course, avenue for the reentry specialists, right? As far as working with the court, especially when you mentioned the sequential interception, right? And of course, and where did we come into that? Where did we intercept that? So I think that one is that with the courts, and then of course in working with the different local mental health authority, who was in, of course, several counties, and then gave us the opportunity to also to provide peer support in those rural areas. Right, and then when we come into a rural area to see, well, where's the resources? And the first place we go is to the court and the criminal justice. Are there a reentry court? Is there a drug court here? And so we was able to do a lot when it comes to the judges in the courts, even in the rural areas and the local areas. Right? And then, of course, having a recovery pod. We've actually created a recovery pod in jail. We've been in maximum and minimum security, so we know that peer support can work in the prison in minimum and maximum security. We have now, of course, in Texas, they've actually provided peer specialist training in there. So that might be something that Sandra would also talk about as far as how the reentry peer specialist, where does it start? For us, we know we want to get them on the inside, wherever they are, as far as contained, whether they're in jail or in treatment or in a hospital. Those three areas where they're confined or inside something, our job is to go in, of course, and spend a little time with them in, so we can be that traveling companion and walking them out with peer support. And that's our goal right there. So that's just a little bit to tap in, because I probably didn't went past your question.
No, that's great. That's great. And there's like both of you, well, all three of you, and just
I didn't even talk about the living room yet. I'll get on that later.
Yeah, no, there's so many great nuggets I want to dive into. So that's perfect. And I think what you were saying, especially towards the end, about the value and the role of peer specialists is a great segue to turn to Sandra and ask you to introduce, we've dropped this name, Reentry Peer Specialist, now a few times. And I'm hoping that folks on the call have some context, at least, for what peer specialist is, given that it's become such a prominent, role in the mental health and substance use side. But for those even who are on that don't, could you give an overview of sort of what are we even talking about here? Why is it needed? How does it differentiate from mental health, from recovery coaches, and talk some about the value?
Sure. So when we talk about peer support, we are literally just talking about people using their lived experience to support others through that journey. And we have had substance use and mental health peer specialists informally for eons, and formally in the last however many years Joe Powell can tell us. But for me, it was just important to be able to create something specific to those that have been formally incarcerated. Because what happened, again, to me, was that I came to the realization that even though the statistics are upwards of 80 to 85% of individuals that are incarcerated having a mental health or substance use challenge, the individual experience for all of those are independently very unique. And so for me, I wanted something that addressed specifically the experience of having been incarcerated. And when I started to think through that process, it really was about trauma. So what happens is, because trauma isn't it's not a very sexy topic, we sometimes shy away from talking about trauma. But to me, specifically, the before incarceration, the during incarceration, and the after incarceration really stuck out to me when I started to think about my own personal experience. And what happened in that conversation was Via Hope was fortunate enough to have financial support from the Hawk Foundation of Mental Health here in Austin. And they were generous enough to allow us funding to develop this curriculum and to be able to provide the training. We also went through the process of asking for certification through the Texas Certification Board, and we were honored to have them be able to provide the credential for this training. But specifically, the Reentry Peer Specialist is not a competitive certification. I don't think any of them are. I think that they all complement one another, again, specifically because of what they are individually to each person. And so in order to be able to qualify for this credential, it really is that you've been incarcerated. You've been in jail, you've been in prison. There are the specific requirements in order to be certified, which is being 18 years or older and having a high school diploma. So those are the basic requirements. What is involved in the process is go to viahope.org and sign up to be a subscriber at the bottom of the page. Because we send out announcements when the trainings are going to be held. Right now, we are not trying to create all of these reentry peer specialists because we understand that we have to take baby steps. And this is about creating a workforce of qualified individuals to be able to support, again, those other individuals with a similar experience. So going to our website and applying, and we do have an application review process. We also have an opportunity for people to be able to really tell us not what their experience was, but what they understand a reentry peer specialist to be, and what is reentry and what is recovery. This is a 64-hour training. It is quite a bit longer than the other trainings, and that is because we really take a lot of time exploring what recovery looks like, what we spend 2 in-depth days dealing with trauma, and those days get really heavy and they get really intense, but we end those days with healing, and we end those days with talking about the hero's journey, which is not a concept that we came up with, but it is a concept that allows people to focus on, this is really about me. This is about becoming a whole person. We could probably have a whole separate webinar about what that means, what it means to become a whole person. But for me, it is, what is it that you need for you to feel whole? Nobody else can determine for you what that looks like. Nobody can determine for you what recovery looks like. You're in recovery when you say you're in recovery, and you start the journey when you say you start the journey. The training allows you to be able to understand that process and to have an environment that's safe, and have an environment that has individuals, again, that have had like experience to embrace you, to support you through a really difficult 6 days, technically 8 days. So it is a 64-day training, 64-hour training, and 2 of those.
Big difference.
Probably could be a 64-day training, but it's 4 hours. And 6 of those days, Monday through Saturday, are in person, and 2 of the days are online. There, we use our e-learning platform, which is Litmos, to have people be able to review the other 2 days of information, and then we use a webinar format similar to this format, where we kind of wind up the training with answering questions, having people, giving them the opportunity to explore more in depth by themselves, and then ask questions of the trainers who have experienced themselves, obviously in reentry. And we also have some trauma experts, because you don't want to have people go through that journey with people that aren't experienced with how to deal with trauma, and how to present that, and how to, again, take people through the healing process. And it's not, I think there's a question on here about where are these, what is the expectation, and why is this, again, why is this necessary? Why does this matter? Why do we need this? And it really is necessary only because of this specific experience that this person has gone through. And it's easy for people to sit around. I'm a PhD, I know. It's easy to study things and do research and think you have all of the answers, but that's not usually the case. It is much more effective to ask the people that have been there and done it. What do you need? What would have made this experience better for you? What does it look like for you to be in recovery? So when we talk about beta tests, when we talk about work groups, that's something that all of, or the majority of Via Hope's curricula, we require a work group, we require a beta test, because we want to go to the people that have had these experiences. And we want to know, is there something that these professional curricula writers, and we have what we consider some of the best in the country to do the research, to put this information together. But before we start presenting it, we ask the people that have gone through it, and they have given us and shared a wealth of information that has guided how this training has ended up.
So that's I'm glad you paused on that point. Could you, for people who are on the call who just don't identify with the term beta testing, is that that's getting into some of like how this has even been rolled out. So could we even start from like the beginning, the process of developing that and just rolling it out, and what beta testing looks like, and
Sure.
And I want Red to sort of share his experience going through that.
Right. Sure. So how the whole thing started really was just an idea that popped in my head literally in the middle of a conversation. And as I said, Hog Foundation was kind enough to fund us through that. And so in every development, the first thing we do is bring together a work group. And the work group is just a small group of individuals that kind of sit around for several days and throw around their ideas of what they think the content should look like. We draw upon curricula that we've already developed, because why recreate the wheel? And then we bring a focus group together. The focus group consists of people that have been incarcerated in this particular event. So the individuals that were part of the focus group had a whole cross section of individuals, multifaceted demographic areas. We had federal incarceration, we had state incarceration, we had local, county, city, we had males, females, we had gay, we had lesbian, we had all kinds of everybody that we could think of that had this experience, which basically is anybody, to come together and really sit down and say, what do you think is most important in order to have people properly taught how to provide support to this population? And actually, a lot of people have asked, why aren't you referring this to as forensic peer support? Because in other parts of the country, and also SAMHSA refers to the type of training that we are referring to as forensic. That we did start by saying we're going to have a forensic peer specialist certification and training. And the focus group felt very strongly, or the individuals in the focus group felt very strongly that had a very scientific connotation, and that what we're talking about is peer support for reentry. So why not call it what it is? And so we changed it to Reentry Peer Specialists. And the beta test is really, again, once the curricula has been written, the content has been created, it's a test group for that curriculum. So we literally walk through the entire 6 days of the curriculum as it had been written. And then we debriefed and we asked them, was there something that was presented that you think either shouldn't be there, should be changed? Is there something you could think of that needs to be added? What is it that you feel like is most important? We know that we could have had literally a 64-day training and probably still not covered everything that needs to be covered when it comes to properly serving this population. However, we were, I think, successful in condensing it down. There are 21 modules. And again, we cover everything from what it means to be in recovery, what it means to be a peer specialist. It is important for us to note as we talk about this, that this certification is not a part of the state's Medicaid billable certifications. I did want to put that out there, that it is not related to that in any way, but it is, I think, a significant training, and we're really excited to have our third group participating right now.
Amazing, really incredible. There's some really good questions I'm seeing a chat box that I want to dive into, but because you're going through some of the details on the training process, I really want to just spend a moment more kind of expanding the window on sort of giving folks a clear image of what this process is like to go through. So Red, would you mind sharing your experience on what it was like to be a part of this beta testing group? What it was like to go through then the training process to learn from these 21 modules. It'd be great to sort of dive into what are the details in those modules, right? What does that look like? You know, Red and Sandra, if you have some, you know, if you want to talk with one another in terms of about that would be fantastic. But just from your own experience, having gone through it, what does that look like? And give people who are on the call who are maybe interested in going through it themselves a sort of window into why should they do it? Why should they contact Sandra after this?
If they are open minded to it. See, if they don't see they do.
For me, the focus group opened some doors and opened some things up that I hadn't thought about before. I didn't realize, and it was a very rough couple days there at a couple points, you know, because there were people, like Sandra said, there were people in our group, in the focus group, who were former and I guess current even TDCJ employees. So we were interacting with them, and some things came up that were difficult to listen to. And at times I'd have to walk out of the room just because it was real rough. Once that was completed, though, it changed. We had a real good feel for the way that the program that Sandra had put together, the way it was going to go, and we had the option to help them change days around, move things around to make it a little better, we thought. And it was nice to have that input. And then from there I got to go to the beta testing, and I was a person who never realized I had trauma in my life. It was something that came out at the beta testing that really just rocked me, because I never thought about I guess as a man, we're fixers, and we're not realizing what's going on with us. So I was
okay. Let me see my phone real quick.
So
Sorry,
for
Red.
me, that's all right. So for me, it was difficult to realize that I'd had that trauma. And then when I actually took the class, I realized at that point that I had trauma back early on in my life that affected me all the way through my life. And one of the things that they talk about while you're in the class is the thing that Sandra refers to, calls trauma, the 3 traumas. And that's, you have a trauma before you go to prison. Going to prison is another trauma. And then you have this release when you have nothing there. That's a whole nother trauma. And it's just very difficult to put that whole thing together if you've never realized you had that trauma to start with. So it was really powerful for me. I got so much out of it that I'd never known about before just by going through that class. So it was a very good class.
That's incredible and powerful, and I think a really important point that we ought to spend as individuals in every capacity that enroll, that everyone on the call is sort of in right now, is thinking through the idea that folks could have gone through trauma and not understand it as trauma. Because I think this term trauma is thrown around a lot, and I think, you know, we have one view of it and we know that it can be nuanced, but I think what's talked about less is that folks might not understand that as a traumatic experience. It was their experience, and because they lived with it for so long, it had to become normalized, and they had to find normalized responses, or they had to find their own responses to those experiences, which then become a part of the normalization process. Do you have any thoughts about that? And sort of, I don't know, how have you been thinking about it in your own role right now, right, as you're serving in clients who are probably many of whom going through the same experience, how you really conceptualize then self-determination in that lens?
Well, it's I don't really dive into the trauma with the people I'm serving right now are freshly incarcerated. They've just been arrested. So I'm starting off right there at that moment. And they all have serious mental illness. I mean, really difficult mental illness to work with sometimes. So I don't get to really do the trauma with them as much as I'd like to. And some of them, the ones I follow for 3 years, I get to work with them about that incarceration and that experience. So that's what goes on with that as far as the trauma goes there. But I can want to add one thing to what Sandra had brought up earlier about how the group, when you go there for the training, you begin to get closer to each other because you realize everybody has all this shared experiences. And when I was struggling in the focus group and had to get up and leave the room, another person from the group, who's still my friend, came out and just said, "Hey man, are you all right?" And we sat down and talked. It was powerful. And we're still friends to this day. You know, he does peer-to-peer sports, and it's really good thing. I just wanted to acknowledge that.
Absolutely, that's great. Sandra, could you talk a bit about are there eligibility requirements? Are there eligibility parameters? We've had 2 questions come up in the chat box that speak to this, both of which I think deserve their own sort of equal time. One is a question around violent and sexual, individuals who are incarcerated for violent or sexual offenses. You know, I know you know this, but just to sort of say, you know, because so much of criminal justice reform efforts have been situated at these quote unquote low-level offenses, non-violent offenses. You know, some researchers talk about this non phenomenon, right? Where we're making all of these carve-outs for who ought to be released or we ought to be developing alternatives for. But that in and of itself unintentionally creates a subset of folks who we are inadvertently maybe saying that this is a deserving result, right, for them. So often that's individuals who are inside on a violent sexual offense, which again is, you know, while I think culturally we like to think about that as very clear distinctions, they're oftentimes not. There's a lot of gray areas. So how does Reentry Peer Supports handle eligibility in terms of offenses that folks were in on? How do you determine, this was the second question, how do you determine whether or not somebody is in recovery? Do they need to be in recovery? At what point in the recovery process are they? Do they need to be involved in before they go through the training? And how do you how do you identify folks? Do folks identify you, or do you reach out to people? How do folks get connected?
So I'll
All
answer
those.
yeah, all of those.
Yeah,
So yeah, we made a conscious decision, and by we I mean the work group and Via Hope, because we made a conscious decision that we don't ask people what their offense was. What we're trying to get at is human beings that are in need of training, that have had experience in incarceration. There is not a evaluation of, again, a crime. When we do mental health peer specialist training, we don't ask people, what was your diagnosis? We don't ask people, you know, what did you do? We ask them if they want to be a peer specialist, and then we train them how to do that properly. We don't determine, which I think I said before, I can't determine when somebody's in recovery. We once they are accepted and they're in the training, we do go over what it means to be in recovery. If there are individuals that have not had any experience with peer support, we have them go through, Via Hope developed quite a while ago through our Recovery Institute, which is our organizational change part of Via Hope. They created some free videos that talk about what it means to be a peer specialist, what is peer support, and they talk about recovery. So we require those individuals that have not had any experience to view those three videos in order to get a better idea of what it means to be in recovery and what it means to be a peer specialist. And but there is no, for me, that feels like discriminating, right? And the whole point of peer support is to get away from stigma and to get away from being judgmental. So I feel like if somebody has had that experience, but again, we go back to this whole idea of, I'm free to walk around in this country, in this community, but I'm not free to work. I'm not free to live where I want to live. If I had a 2-day sentence, if I had a 5-day sentence, if I had a 55-day sentence, and I'm released, I am still doing a life sentence. And that's something that we as a nation really need to get a grip on. Because if you're saying that X amount of time is what I'm serving for my offense, why are you letting me out, but then you're still treating me as if I'm still the person that's incarcerated? It literally makes no sense to me. So yeah, I'm a little passionate about this, sorry. But to answer the question, we don't ask those questions. Again, the qualifications are, have you been incarcerated, jail or prison? Are you 18 or older? And do you have a high school diploma or a GED? Those are the requirements for the training. And the other part about being in recovery, again, you're in recovery when you say you're in recovery, and we do provide some tools as a preface to the training for those that are not familiar with peer support and recovery. Amazing.
Equally as passionate on those points. We had lots of head nods around the room where I'm seated. So I'm excited about that. Joe, can I ask you to speak a bit on, from a workforce perspective, right? For individuals that are on this conference call, the Zoom call, who are, you know, a provider in the space, or could potentially be in a position to employ a peer specialist, right? Mental health or reentry, but reentry in particular. What should they know? Like, what are the benefits of hiring this role? What's the benefits of hiring these folks in particular to be a part of their staff? What's the value add?
Well, I think that that's very important. That's a great question too, because of, again, just my quality of life as a peer support, once I come through the training or once I'm released and I start this whole new life of in recovery, that right there, period, is going to change my health, wellness, and recovery moving forward with the quality of life and that I want. Right? And some people don't even see they will ever have the quality of life as somebody else. I think we all should have that quality of life, and I want the quality of life that I have for everybody, right? And my mentors, I want, so we want that. But I think with employment, with peer specialists, one, especially being a community organizer and also a person that has that's over a recovery community organization, we're in many different settings, and especially with a criminal justice system is involved, and there's so many moving parts to the criminal justice system. And of course, when you're talking about reentry peer specialists or jobs for the workforce, then that is right there is huge. I'm just looking at even all of the questions that are popping up on the screen, and as asking, right there tells me how many jobs and how many positions are still available. Everybody, we don't have peer support in my county, in my jail. What about juvenile, et cetera? So, but yeah, the workforce we're just really beginning. The hero's journey is really just starting for a lot of us. But I think that, again, that's what with lived experience and hanging out with people, like what we call affiliation support and companionship support, is who do I hang out with? I hang out with people that are really have a quality of life and is really moving in recovery, have the recovery that I would like to have, or and so we need each other.
Those are
Another thing is that I can't give you something that I don't have, and if I have not done the work on me to move toward health, wellness, and recovery, then it's going to be hard. I can still be stuck in my thoughts and my feelings and my actions, including with the justice. You gave the data earlier, said how many get rearrested after 3 years and 5 years, and how that went up to 76%. That's huge, right there. And that's where recovery, that's where reentry specialists, that's where we come into right there. Our job, the value is that, we will decrease that number. Those numbers are the numbers that we're going to decrease. Okay, is the recidivist rate and definitely rearrest rates, right? But also we want to increase, right, and peer support in all of these settings and all throughout the behavioral health, criminal justice, hospital, primary care, wherever people are. When we started APA, I said that's where peer support needs to be. People need to know about peer support. This country has an opportunity now, really, to join, for all us to join in this healing, we say, in separateness is sickness. So we want to join with our community to move our community toward a recovery-oriented community of, and systems of, right? And that's where the peer support, that's where reentry peer specialists are. I think with us, with the living room, I'm aware of my time, so I'm just gonna say this right quick. I don't know when I'm gonna talk again, but the living room, for instance. So in our community, right, when you have a district attorney that is also a community partner that really knows about recovery, that know the value of recovery. And so in Houston and in have their jail diversion. In Dallas, we have the living room, which is the Dr. Lewis E. Deere Behavioral Health Complex. And in there, of course, there's an opportunity to do some diversion from the jail, to do diversion from the crisis, from the hospital, people that are in crisis, right? And then they get the chance to come to the living room and really learn about not only support, but there's a clinical team and a peer support team working together, right? And so how does that, and the care coordination that has to happen within the behavioral health system, within our local mental health authority. I mean, this living room is really dynamic. It's the first of its kind in Texas, because also you got a recovery community organization that's connected also to it. So that social connectedness is there too for people that's coming out, right, out of the jail, out of the hospital, out of treatment. And so now we can connect them to the community, but also for my staff, because I got 28 staff right now, and all of them know, and most of them have been part of the justice involved, been involved with the criminal justice system. So we want to make sure, though, that we all really provide and really move toward health ourselves. Because again, I can't give you something that I don't have. I don't want peer specialists to be stuck. And I think that that's why I love it that Sandra, she really articulated as far as the trauma and how important that is, right, to moving past that into recovery.
Fantastic. And that's a great segue into my next. I mean, that was a perfectly comprehensive view of sort of behavioral health system and other employers. What's the value add? Wonderful. Red, you had shared something on one of our planning calls that we had for this event about your boss's perception of, I mean, both speaks to your own quality of work and the personality you bring to this, but wanting to get this particular role at all of the sites throughout the state. Could you talk a little bit about that and sort of what drove him to that decision, and you know, sharing it in ways that if there's folks that are on the call that are from the legal profession, why should they be educating other attorneys about this?
I was the first peer specialist hired for the public defender office here, and the only one to date. But my director has come to me, and he wants to try to move peers into all the public defender offices. When somebody is arrested and they're in the system for the first time, it's overwhelming to anybody who has, you know, their ducks in a row. When your life's together, it's a mess. It's very overwhelming for you. Can you imagine trying to navigate that with you know, serious mental health, where maybe you're hearing voices or you're seeing things that aren't there? So what the value I bring, that I feel like I bring to the public defender's office, and that's the value he sees in it, is that I can meet with them initially, and I walk them through the entire court system until they're adjudicated. I get to interact with the prosecutors, with our defense attorneys. I interact with the judges, and they value the opinions I have and the directions I try to help them with. I try to offer alternatives to incarceration. Like, let's get them in this program, or somebody who hasn't been to a program, let's try to get them help over here. So because I've been doing this, it'll be my second year working down here next month. There's a history there where he can see value in what I do, and that's why he wants to try to get enough peers to go to each of the public defender offices. And I think every public defender office should have somebody to walk somebody through. You know, and just as a side note, think about all the people that I don't see, because they have to have Access 1 mental health problems for me to see them. So there's a lot of people who maybe they're depressed, or maybe their only issue is that they have substance abuse issues. They slip through the cracks because I don't have enough. There's not enough of me to see all these other people that could be using reentry peer help, you know? So I think that's the reason they're looking to move and get more people into it. And I think every public defender office should have it. It's just a powerful tool. I really like my job. I mean, it may be hard to tell, but I love my job. So.
No, that's amazing. Thank you both. That was really helpful. We're starting to approach our 1:30 mark, and I see a few participants have already left. So I want to put up the last slide on the PowerPoint, because it has the link to the evaluation. It also has a QR code that if you're high tech and you get QR codes and you've got a thing on your phone that you know exactly how it operates, to scan that QR code, and it will automatically pull up that site. For the rest of us, myself included, that, you know, just aren't equipped in that way, you can easily copy and paste the link right here, highlighted in blue. My colleagues are also putting that link in the chat box for folks, so that you could easily just copy and paste it into your browser right now, or click on it. It is hyperlinked. Please, please, please fill out that evaluation form, because we can provide for all of you that I see. I'm so excited are adding to the chat box with, I want more of this. I want, you know, all of these people to, know about this. We can do that. We just need to show SAMHSA that there's a demand for that. As people are doing that, I'm going to leave this screen up and ask a couple of pointed questions that were on the chat box. I don't want to leave, because several folks asked very similar questions. that I think will have pretty short answers. The first being, one, Sandra, when do folks connect with you? While they're still inside, while they're out, both? How do folks connect?
Right.
For folks that are on the call that have a loved one that are inside, what do they tell the loved one about getting a hold of you?
Yeah, so right now, we are baby steps, right? We're currently providing the training to individuals that have been released. So right now it'd be after release. We are having conversations with quite a few different organizations trying to come up with ways to provide it inside of facilities. So for people that are soon to be released within the 6-month period, that isn't finalized yet. But for right now, it's just for individuals that are currently out. Yes.
Cool. Wonderful. Second question. A lot of folks that are on the call have a loved one that is inside, and they really want to know if they can take the training and be a part of public education. Yeah,
again, a lot of conversations about how to create something different because again, this particular training is specifically for people that have had this experience, because we're training them to use that to help support others. But the hope is that we will have something similar for those that have family members, and but that is not available. We should have a curriculum completed somewhere in late winter, early spring that is for organizations, which will be called Demystifying the Reentry Workplace. So that will allow us to go to organizations and give them a lot of the information that was given on this webinar, and just to explain to them the benefits of hiring people that have been incarcerated. Stuff as simple as tax credit that people just don't know about because they don't know about it. We're developing. We want to make sure that this curriculum is good and solid, and that it's providing what it has been intended for. And then we will develop further curricula to support, hopefully, family members and other individuals that are just interested in supporting this work.
Brilliant. Last question. We still got over 100 folks that are on, and so bear with me, we're gonna go a couple minutes over, but I do wanna make sure to address, I think this is the last question that kept appearing unless my colleagues tell me otherwise. When we say reentry, are we only talking reentry on the back end? Or are we also talking for folks that are diverted, or if they go through a specialty court program and are coming out that way? Is that qualified as reentry?
Those people, diversion courts will have, that's a huge population that we're trying to reach with the reentry specialists. So in the technical term, if I was diverted, that means that I didn't go to jail. But if you were arrested and I didn't go to prison rather. But if you were arrested and you did go to jail, you would still qualify because it's jail and prison, if that makes sense. We are hopefully, that is one of the places, and one of the questions are, where are these people going to work? And of course, my answer is more optimistic, which is any and everywhere. But our target right now is really diversion courts, reentry community centers, organizations, parole and probation. Ironically, we had someone from TDCJ say to us just yesterday that I feel like a reentry peer specialist should be in every parole office. I mean, my heart just melted, but I agree with them, of course. So those are our target populations, is really getting to those people as they are newly coming out. And because that's what, as Mr. Powell said, that's what's going to stop recidivism. That's why, it is being termed a solution, not the solution, but a solution to recidivism, because once an individual can deal with their stuff, they're more likely to be able to function in this not so fair society that we live in. So that's like the ultimate for us, is to be able to get people equipped. It's really important to know that they do not come out with any sort of trauma certification, but they do come out more trauma informed. And again, I think that is a key differentiation that I want to make sure that people understand.
I think that's great. And to that point, they also don't come out with mental health peer.
They don't come out with substance use certificate. They don't come out with a mental health peer specialist certificate. They come out with a reentry peer specialist certification after they pass the exam and submit their paperwork to Texas Certification Board.
Beautiful. Fantastic. Was there any other multiple questions? Okay, perfect. Thank you all so much for everything that you contributed to this event, your words of wisdom, your expertise, your experience, the many years of blood, sweat, and tears you've given to this field is really having a remarkable impact on the field, on providers who wouldn't have otherwise been introduced to these unique needs. And most importantly for folks that are inside and are themselves cycling through the system as we speak. Thank you all so much. And thank you all to all of our participants that joined us today. I'm so glad that you are on. Please, please, please fill out your evaluations. If I haven't said it enough, I'll say it again. And you will likely get an email from me with that link and the QR code so that you can fill out the evaluations, and I'll probably bug you for the next 7 days when you are due to SAMHSA. And then, you know, I'll just be in touch in a regular fashion to get you the information that you need and have asked for. So thank you all so much. Please check out our website. We are rolling out a whole lot of mental health / justice and behavioral health trainings and technical assistance. And we would love to provide you and meet any of the training and technical assistance needs that you may have, and work together to determine what that could be. So thank you all so very much. And I will look forward to staying in touch with all of you.
Thanks, Alicia.
Wonderful day.
Thank you.
Thank you.
Thank you.
Thank you.